Hi, I'm Dr. Folu Balogun, also known as Folu for short.
Hi, I'm Dr. Onyinye Balogun. We are the Docs.
Our guest today is the #1 New York Times bestseller and National Book Award-winning author, Dr. Ibram X. Kendi. He's also the founder for the Center for Antiracist Research at Boston University. He has been a leading voice on the topic of anti-racist practices and joins us to share his experience about his previous diagnosis of colon cancer and treatment that followed.
So, Dr. Kendi, thank you so much for gracing us with your presence. I'm going to try and keep it, cool, but we're huge fans. And we're so grateful for the work that you do, as director of the Anti-Racism Center at BU, for all the books that you've written and all that aside, I think, your wife also was ahead of me at medical school, and she just was always talked about in with the highest of esteem by Linda, who ran the office for, the students to come and hang out. So I've never met her, but I'm a fan from afar. But thank you for joining us today. We started the Docs in order to shed light on the experiences of Black individuals with cancer. Even though we experience the highest disparities across the board in so many different tumor types, when you look at social media, when you look at things like podcasts, they may have a sprinkling of episodes focused on Black individuals here and there. And so we wanted to really introduce into the narrative more stories of our experiences. And I think you are a phenomenal individual to speak about your experience. We'll let you take the floor and talk to us about your diagnosis, and we'll follow it up with some questions.
Sure. So I started having symptoms in the fall of 2017, particularly the weeks before Thanksgiving. Those symptoms included having to go to the bathroom more than usual, and then ultimately almost like every hour, losing weight, which I wasn't necessarily aware of. And then I had what I thought was a stomach virus over Thanksgiving, and I started like bleeding in terms of number two, and it didn't stop. The bleeding didn't stop. And by that New Year's holiday, the real Dr. Kendi and I decided to take a trip together to, I think it was Los Angeles. And I had done a lot of traveling those previous few months. And so that was when I think she saw the totality of all my symptoms. And I think by then we had already scheduled to get my colon examined. And so when she saw the totality of my symptoms, she actually got on the wire and was able to get an earlier appointment, I believe on January 10th, because she knew I wouldn't do it. And then I went and got my colon examined, and the doctor noticed a mass that she could barely get her scope past. And then I got imaging done the next day and was told it was stage 4 colon cancer.
I can imagine, thank you for sharing the story, but I imagine how hearing about a diagnosis of cancer not only affects you, but affects the family, the friends and loved ones. At that moment, what thoughts crossed your mind initially?
So I think I was just shocked at every level. I think when we knew there was something going wrong because of all of the symptoms that I was having, but I think I had met previously with, some medical providers, and I think because of the risk factors, which I didn't have any risk factor other than I getting subject to racism.
The risk factors for colorectal cancer include obesity, smoking, a family history of polyps in the colon, or a family history of colon and endometrial cancer known as Lynch syndrome, as well as others. Dr. Kendi points out that he did not have any of these common risk factors, but states that racism may have been his risk factor. His comments remind me about weathering. Weathering is a phenomenon first described by Dr. Arlene Geronimus in 1992 when studying the higher maternal mortality rate among Black birthing individuals. This theory states that continual exposure to racial discrimination leads to earlier and faster aging and worse overall health in Black individuals.
They did not think it was colon cancer, so they had some other theories. And so then when the doctor came and told me that she saw a mass, I remember that night, Siddiqa and I thinking, okay, you know what, it's cancer, but it's likely stage 1 or 2, and then to find out the next day it had spread, to my liver. I mean, at every level, I was just shocked, and my family was shocked as well.
It is always disheartening to hear about another Black man diagnosed with advanced stage colorectal cancer because this can be prevented. Compared to all other racial and ethnic groups, Black individuals are more likely to be diagnosed with colorectal cancer. They're 20% more likely to be diagnosed and 40% more likely to die from it. Access to care is a significant contributor to this disparity, with screening being a key part of preventing cancer and increasing the chances of cure when we catch the cancer early. Screening of note occurs when we don't have symptoms. In colorectal cancer, the age for the average risk individual to start screening was decreased from 50 years to 45 years old, and this is due to the increase in colorectal cancer diagnosis in younger individuals.
And you talked a little bit, you were 35 years old, and you say, in other interviews you've done like GQ, you say that you were vegan and you had these health habits that you thought maybe made you not take the symptoms as seriously to begin with, and that you then started wanting to atone, I guess, for this mistake that you made by not letting your doctors reduce the chemotherapy. Can you take us through like the psyche of that? And have you seen that in other individuals who have shared their cancer story with you?
So yeah, when I of course went about getting treatment and did 6 months of chemotherapy, and I remember that my oncologist started me on the strongest dose of chemotherapy, and of course it was incredibly difficult to withstand, but at the same time I was very upset at myself for allowing it to get this bad. And so in a way I refused to reduce the dose, but then simultaneously I knew that the stronger the dose, the stronger the bullets at the cancer. So I was just like, maybe it could help. And I just tried to focus on doing things that could alleviate the symptoms of chemotherapy in particular. So like, of course, my hands started getting extremely blistered and black, and so did my feet. So I bought these gloves and these socks that were like moist, where I could sort of lotion up my hands and feet before going to sleep, which helped. Whenever I would go outside, of course, particularly during the winter, breathing in cold air was extremely difficult. So I figured out ways to not do that. I drank a ton of water and took a ton of protein each day to try to lessen the sort of feeling of toxicity. And so, yeah, it was to me a whole ordeal. And I actually decided during my cancer treatment journey to not spend quite a bit of time talking to other people who were going through cancer at the same time, largely because I thought it could certainly impact me positively, but I didn't want it to impact me negatively, and I didn't know what type of impact it would have.
Absolutely. I think that's a common thing that we hear. Sometimes you're sharing your story with other people and they say, well, my cousin had this, not understanding that there are nuances, that there are cancer, even when you say colon cancer, so many different types, so much that we don't know. One size does not fit all, but yet people struggle with not trying to prescribe to you that this is how you should do it. So completely understood.
Dr. Kendi, you mentioned in prior interviews about like a survivor guilt, because fortunately, even though it was stage 4, the cancer was fully controlled by the chemo and the surgeries. But you also just mentioned now about feeling maybe mad at yourself that you let it get this far. And it's something that I see where there's this guilt where people are always trying to find a way to say, what did I do wrong that caused me to have cancer? Did you feel guilty or feel like in some way you contributed to this? I mean, you're healthy, exercising, on a good diet, great diet, and everything. But was there that guilt early on? And how did you, if it existed, how did you manage it, or how do you manage it?
I certainly felt guilt because I felt like the symptoms were screaming at me for months, and I was sort of explaining them away and ignoring them. I think at the time I had just started a new job at American University, of institute there, and I was just traveling out, and I just not taking care of myself, in terms of prioritizing. I just started coping with the symptoms as opposed to addressing them. And indeed, if it wasn't for, Sadiqa, I may have just continued to cope for them. And by the time that it became impossible, because I was so actually close to, my whole colon being clogged, which is probably what would have, led me to essentially not be able to continue on. By that time, I could have spread past the liver to a point in which cure was not even possible. And so I felt a lot of guilt and anger at myself. And I also felt survivor's guilt, especially when I think it was 2 years after my surgery date, I found out that Chadwick Boseman died of colon cancer. And, for me to live and for him to die, was devastating.
We often don't talk about survivorship enough in the community. This part of this, wondering, yes, I feel fortunate to live, but why me? Why not someone else? What are some of the other things as a cancer survivor that you grapple with? And even some things, specific to being a Black man and a young man who went through this.
To your first question, I think one thing I've been grappling with is particularly over the last 4 years, I have felt as if I did not have time. When you believe you have time, you feel you can put things off. You can say no to things you really want to do because they'll come around later.
Mm-hmm.
And I just have not had that perspective. And I think that there's been good aspects of that because I've sort of pushed myself to do things that I wouldn't normally done. But then there have been bad aspects because I ultimately put too many things, on my plate and even on the plate of others. So it's been something I've been really grappling with. I feel like I'm finally at a point in which I'm starting to think I may have time. And so I feel like I'm starting to slow down somewhat, but certainly that has been the case because I feel like I've been living 3 months time until my next sort of screening. And then secondly, as a Black man, I tell the story in, I think it was How to Raise an Antiracist, about when I was after my surgery, and of course the doctors encouraged me to just walk around the hospital to try to sort of recover or accelerate the process. And I did not want to be in the hospital, so I would walk all the time and really pushed myself. But I remember those times in which I was walking around the hospital with all of the machines and seeing a level of empathy for me that I've never really felt as a Black man. In a way, it showed me what was possible if we lived in an anti-racist society. where, Black people too, just by walking down the street, people could be empathetic towards them. They don't have to necessarily be this patient who is walking extremely slow with all these things, attached to them.
Yeah,
Great
I read
insight.
an article and I want to congratulate you on being on the banned books list. You were the number two, like, banned book. When this movement to ban books in our school system. So to me, that says you're doing something right. Your book stamped, right? With Jason Reynolds. I think it speaks to its power, its potential to influence our kids positively. And unfortunately, some people just don't want to see that. I'm so happy to hear that. For me, I mean, I've known about your work for some time. I do think your star kind of skyrocketed 2020 post George Floyd, or do you see a different trajectory? So this means that you were receiving that empathy before really widespread popularity. Is that true? Am I getting those
Yeah.
timelines right?
Yeah.
So that really warms my heart, because if you're a celebrity already, I'm like, oh, of course, people were like, being nice to you. So that brings up this idea of, even as cancer patients, right? Part of the reason we have cancer disparities is because even when people are in pain, Black people are in pain, they choose not to see it. They're less medicated. They're diagnosed later. Because I have so many women, for instance, who come to me and say, I went to them. I said that something was wrong and they didn't take me seriously. So happy to hear that you had that experience, because how do we get to the point where more Black cancer patients are treated empathetically?
I think it helps for us to be able to expand healthcare access, particularly high quality access in Black communities, and for there to be medical providers there who are anti-racist, meaning they are there to assist Black people. They don't think that Black people are to blame for why we're dying at the highest rates from cancer. They do not consider themselves to be anti-racist because of their proximity to Black people. They consider themselves to be anti-racist based on how they're treating these Black patients. And I can also remember one thing I think I didn't share was, so after I started chemotherapy, then we started having conversations with surgeons. And I had a consult with a surgeon that was not at the hospital that I was receiving chemotherapy at. And the hospital I was receiving chemotherapy at was one that primarily served like working class Black patients, in the city that I was in. And so after I received the surgical consult from another surgeon at another hospital, who told me that he could technically go in and remove tumors, particularly in the liver, but he would want them to shrink as well, as, of course, because it'll just make the surgical procedure easier. Then I went to the head of surgery at the hospital I was getting chemotherapy at, and by that point, I had already had a CT scan and an MRI. And so this surgeon comes into the room, and Sadiqa's with me. And I think he knew or learned very quickly that she was a physician. So he asked her, are there any differences between the CT scan and the MRI? So he didn't look at the MRI, only looked at the CT scan. Then basically went in and told me that he did not feel there's much he could do for me, that, even if he was to be able to remove the tumors, they would almost certainly come back. And so I'm sitting there like, what is going on here? And meanwhile, Sadiqa is not asking any questions. So I'm like, what's going on here as well? Because she typically like bombards the physicians with questions.
Not a good
So
sign. Not a good sign.
Yes. So as soon as he leaves, she says to me, because I'm horrified. Like I'm like, okay, so like this is the end. She says he doesn't know what he's talking about. Once he said he didn't look at the MRI, I lost all respect. But
Mm-hmm.
this is was the head of surgery at a major hospital that primarily serves Black patients.
That's that access to high quality care you're talking about. That really erases most of all these disparities we're seeing. Being that you were young when you were going through this, uh, was there any talk of genetics?
I like to define genetics or genes as the blueprint for our bodies. It is made up of what is called DNA, and the information is passed down from parent to child. When errors exist in the genes that parents pass down to their children, it is inherited. These inherited errors can increase the risk of getting certain cancers. So that makes it important for us to understand our family history and genetics. Furthermore, cancer tumors tend to have genetics that are different from the rest of the body. So that can help us with selecting the most appropriate treatment for individuals undergoing cancer treatment. Another reason to understand the genetics when diagnosed with cancer.
So I think if I remember correctly, I think we did speak with a genetic counselor, and I think they ran testing, and I think they concluded that it didn't necessarily emerge from my genetic makeup. I do not have colon cancer in my family, although I do have a history of cancer. My mother has endured cancer. My father has endured prostate cancer. I have an uncle that died of, I believe, lung cancer. Another uncle that recently died of cancer. A grandfather that died of cancer, and so it's all throughout my family.
Yeah, that's a lot. Condolences to everyone. Did you find out, interestingly, when you say this, and just thinking along the lines of these risk factors that were brought up with the genetics, but also with family history, did you know about the family history of cancer in the family prior to your diagnosis, or this came up mostly after?
So I knew all of those because obviously my parents had experienced cancer. My mother literally had dealt with breast cancer, I think 2 years before I was diagnosed. And I knew my grandfather, my mother's father, had died from cancer because he died a few months before I was born. And I also knew my mother's brother had died of cancer because he also died, I believe, a year before I was born. So, of course, the family had always talked about both of them. Now, I think in the case of both, my mother believes till this day that both her father and her brother were mistreated, and that's why they ended up both dying. At some, like her brother was probably I think in his 30s.
So it's unfortunately it happens more commonly than we would want it to happen. One of the big risk factors that a lot of us don't know about is family history. And
Yeah.
fortunately, good that you knew about it. We don't tend to talk at the dining table or at the dinner table, but knowing that information kind of can really help us undergo the appropriate screening at the right time.
I think one of my biggest frustrations, and I'm sure this is an even bigger frustration for each of you, is that cancer, the second leading cause of death in this country. But when you look at what our elected officials have decided to spend money or our money on, I mean, it's just preposterous. Or it's always fascinating to me that every time someone dies from, let's say, a homicide, it's on the local news, but every time someone dies from cancer, it's just accepted as something that happens.
Yes, the amount
Yes.
It's not preventable.
I know our time is running down and we want to be respectful of your time. So I'll just say two quick things. One is thank you for all the work you've done. I guess you alluded to the fact that, maybe 400 Souls, your work on the 1619 book, all these books may have stemmed from this like feeling of, I don't have enough time. So I wish it didn't stem from, that kind of like anxiety. The second thing is, if I can, I wanted to read a quote of yours. from an article that appeared in Cancer Today. So you said we're taught, particularly as men, to hide our emotions, our fears, our inner thoughts. We're effectively taught to hide our scars. We're taught that this hiding is masculine, when in fact, it's easy to hide. Cowardice hides. What takes courage is to be vulnerable, to bear our scars to the world. And I just think the image of you in that GQ article where you're showing the scar from your liver surgery is powerful. And also coming here to talk to us today and to be transparent about what you've gone through and what you've experienced is courageous, and it's powerful. And like I tell a lot of people who come, I think you will probably save a life, if not many lives, by what you've shared with us today. So thank you.
Welcome. Thank you to each of you for all the lives I know you've saved and all the lives you're going to save. As a cancer patient, I know I speak for many, many folks.
Thank you so much.
Thank you.
For more information about our podcasts, visit our website, www.theoncdocs.com. Please subscribe to our podcast on Spotify or Apple. And if you like what you hear, please give us a review on Apple.